Hey, good morning, everybody. I'm testing out this. Let's turn this volume down. Testing out and playing around with this live streaming thing still. So please join in with me. Ask me some questions. I'm watching. We're going to try to do some live Q&A, talking a little bit about Medicare, talk a little bit about Hurricane Milton coming through. It is not looking good for the middle of the state. Let's see here. Trying to keep an eye on my comments as they come through, testing around a little bit with this software I use. I've been using StreamYard for these live streaming. It's actually allowing me to stream on multiple platforms. I'm currently streaming to my Facebook page, my YouTube channel, and Instagram right now. So kind of interesting, playing around with it, trying to get a look at things, see how things are running. So testing it out. Please hit me up with some questions or comments. I'm going to try to answer them. I think I had some comments yesterday and I missed them, so shoot me some comments. I don't know, trying to see how they relay through the StreamYard platform. Let's see here. Looking right here on my screens. It's done. Yeah, hit me with your questions. See what's going on. See, maybe find somebody maybe wants to join us. I think I can bring in some clients as well. Let's see here. Does this work? Oh, it shows up, but it's. Let's see here. Let's turn that off. There we go. That's better. We've got some QR codes up here in the right and left. We've got an option to be able to self-enroll in your Medicare plan or just schedule an appointment with me. You can schedule a quick chat or review your Medicare coverages. Let's see here. So, shoot, let's talk Hurricane Milton a little bit. Let's share the screen here. So, I follow Mike's weather page on here. Let's make my bubble a little smaller. So there's Mike's weather page. I think he lives in the Tampa area, so I don't know if he's evacuated or sitting through it. But he's been posting lots of good stuff here. Let's get rid of some of this junk. Here. Well, leave it. We'll leave it up for now. So let's see. I'm gonna try to leave this live for another 20-30 minutes, see if I can't get some comments. I'm trying to watch those come in. Leave your comments, guys. I missed a few yesterday on my first live stream yesterday, so I got some feedback talking about some of the picture a little bit. Some of it looked good, some not, so I've adjusted the lighting. So hopefully, somebody said it looked like my fish behind me was sticking out of my head. Somebody said that looked a little funny, so I'm gonna adjust the lighting. But I'm here from my office here in Jacksonville. Luckily for us, not so much for middle and southern Florida, but it looks like we're going to catch the back end of it. It's going to hit us more this evening. So I'm here working today till I'll get off a little early, around 3. Please forgive me if let's see here, update layout. Please forgive me tomorrow, especially I know you'll be fighting with the hurricane and what's going on in recovery in the next few days. So let's pray for everything kind of, for the most part, holds together. But it's looking rough for the Tampa area. Our corporate office is in Clearwater, so I know they've pretty well shut down. And I think most of the evacuation orders are there to get out and leave. I hope everyone stays safe. If you have the ability to evacuate and you're in an evacuation zone, please do so, because this is going to absolutely just crush the West Coast here, and still just recovering from Hurricane Helene that hit us like a week and a half ago. So this is terrible. This is a rough year. So anyway, so let's look a little bit on these. Let's talk about the hurricane just a little bit. So I'm no expert by any means, but this is something Mike just put out about 36 minutes ago, and I believe this is talking about tornado outlook. So what are our chances of hitting some tornadoes? So there's definitely some tornado outlook here around the edges. We're catching more of the outskirts here in Jacksonville, so less likely to get some tornadoes in the immediate future. But Palm Coast through to Tampa, Orlando definitely has a higher chance of seeing some tornadoes. So stay safe. It looks like this is probably the path as it's going to cross Florida here. It might hit a little further south. It's been ticking further south. Here's a storm surge forecast. So all the way down here to Sebastian's Inlet to up into South Carolina, expecting up to 6 foot of storm surge, where it looks like Charlotte Harbor and Tampa could 12 foot. Just south looks to be between Anna Maria Island and Boca Grande, they're expecting 12 foot plus of storm surge. That is just insane. So let's see. Here. Need to make some adjustments, and that might be why I'm not seeing the chats as they come through here. Maybe they're hitting not relaying through for some reason. So I'm going to play around with it and see what I can get figured out. We'll play with this more. I'll be testing this more over the next few days, hopefully right after the hurricane and right before Medicare AEP starts next Tuesday. That's October 15th. That's when you can start submitting applications for your January 1st effective date on your Medicare coverages. We'll talk about that here in just a little bit, because with this storm, we're going to have an extended period, and Helene opened up a period for us as well. So, but please stay safe, especially if you're in this area, if you're near the coast, if you're in a flood zone, be careful. We lost a lot of lives to Helene, and I'm hearing on the news it might even be a lot more lives in South Carolina that haven't even been counted yet. But the Panhandle was just crushed right there, right in the bend. The Big Bend was just crushed from Hurricane Helene, and we're going to see a lot of storm surge from this. You're going to get a lot of aftermath from this storm as well. Let's see what other info he's put in here. I'm not sure what that's going. This is talking about where it might actually hit. Looks like it's going to hit a little south of Tampa from most of the spaghetti models now. Let's see here. Lots of questions. All kind of crazy stuff. Here's the rainfall, what's expected in inches. So, shoot, right there at Tampa and south of Tampa, they could be getting 16 to 20 inches come across there. That is absolutely insane. Our flooding risk through the middle of the state. There's a potential of a 70% chance of flooding straight through the center of the state. That is absolutely insane. I mean, those in Orlando, north of Orlando, Tampa, all the way over Palm Coast area are just, I definitely worry for them. My prayers go to everybody in Florida that's going to be affected by this storm. It's going to be devastating to Florida. I really hate it for our potential homeowners insurance premiums next year with Helene and then Milton. We're just going to get wrecked with homeowners insurance premiums. So I do not do homeowners insurance. Thank goodness. I don't want to deal with that. I don't do property and casualty. If you need a good property casualty insurance agent, I have an agent that's in the plaza where my office is located. I could refer you to, or there's many more. I've got a handful. Actually, there's a couple down in Ponte Vedra, some good agents that I've referred to, and some other good property and casualty agents around here in Jacksonville. So if you need a PNC agent, please reach out to me. I'd be happy to recommend one to you. They are also like brokers in the sense they represent multiple carriers to help make sure you're getting good coverage. Wish I was seeing these. I wish I was seeing my comments. I think I've got comments coming in. I'm just not able to see them yet for some reason. So I got to play around with this and test this out and see how to fix it. See if I can play around with it. And as I'm checking out, more of these models, this was about 2 hours ago, more of the track. Here's our warnings as far as looks to be potential track area. Looks like, the hurricane's going to go just straight through the center. Even up in Jacksonville, we're going to get definitely some hurricane potential. We'll definitely be catching a lot of the back end of that hurricane. That hurricane spins in a counterclockwise motion. So as it crosses the state and starts getting more power as it hits the Atlantic, our coast up here in Jacksonville is really going to get pounded, just like, on the back end from those back end trails from the storm. It's absolutely crazy. Let's check out his Spaghetti Models website real quick and see what we can see there. I got to figure out how to fix my stream so it's public. I got to see what's going on so I can answer the questions. I will play with that some more later. Let's see here. Here's Daily Brew. Let's see. He posted this. It's going to open up for me. Let's see what we have here. That's his YouTube channel. This looks like a pretty good graph showing us some more. Showing us what we're going to hit here. Good grief. Hurricane wind speed probability. So here it's heading straight at us. It'd be nice if it would just run on out of here. Just get out of here, Milton. But we're going to hit it. We're going to get it. We're going to take it to the face. We're going to take a punch right in the face on the West Coast. So let's see here. Rainfall potential, peak surge, storm surge. We got all kind of good stuff going on here. Tornado potential, key messages, warning surface wind, phone statistic images. Let's check this out. Let's look at a 3 days forecast. Where it's going to be. Initial infield. So here's a good look at what we might be looking at and where it's going to hit and exit. We're definitely in a hurricane warning up here in Jacksonville. We're definitely going to get some back ends of it, and just this whole end of Florida is really going to take the brunt of it. And then on the back end, the east coast of Florida is going to probably see hurricane winds here too. So let's see if we're going to be hurricane. It's going to come out here, and what's it going to do once it gets out of here? Hopefully, just keep running on out of here. Let's see what. Wish we had a better spaghetti model. Here's arrival times with winds. So it's really going to start catching up to here in Jacksonville. It looks like we'll catch part of it around 2 p.m. today, moving into this evening. Let's see here. Keep moving along. Look for comments. I'm not seeing any comments come through, so it might be my streaming software. Got to play with this a little bit. Looks like I'm only seeing comments right now from YouTube. So let me try to figure this out. I'm gonna bring it back here. I'll leave that on. I'll leave that on. I'll try to figure this out. All right, so I think my audio was just removed, so I'm trying to figure this stuff out. It looks like some of the kinks are working out. I can see it in Facebook there. Hey, Miss Aunt Margaret, thank you for joining in. I'm testing out my software to see what I can try to figure out here. What's going on? Let's see. There's something to do on my. I should be seeing the comments and being able to reply right from my StreamYard platform, but I'm not seeing anything. I'm only be seeing any YouTube comments or questions for some reason right now. So I'm trying to figure out why it is not showing up. Let's see here. Where is? Where is my privacy icon? Okay, hopefully that has made it work to where my privacy icon's there. I've been playing around with these live streams, trying to figure out how to relay and see my comments. Let's see if I'm getting anything here. Let's see. It should be set to public now. Should be seeing the comments. If you're seeing my live stream, do me a favor, comment on my Facebook page and see if I'm seeing these comments. I'm not quite sure. Let me see if a comment's coming through. I'm not seeing anything in my StreamYard. I'm still testing it out, trying to get it to work. See if I can find out on my Instagram. See if the Instagram's coming through. Yeah. Oh. I'm not sure what's going on with that, so I'll keep playing around with it. Sorry if y'all have to sit through this with my comments or seeing my live streams and it being a little delayed or not getting your comments right away, but I'm going to keep trying to test it out and try to get it figured out. So let's get in here and talk a little bit about, we talked about the hurricane. Let's talk about Medicare in this hurricane. So when the governor declares a state of emergency in your county, that opens up a special enrollment period. So next week starts the annual enrollment period for Medicare. That's normally your time frame where you would be selecting your Medicare plan and either making an adjustment or picking another plan or just reviewing your coverage to make sure you're on the right plan for next year. We normally have between October 15th and December 7th every year. If you're on a Medicare Advantage or a prescription drug plan, you can make a change during that time frame. When you change your plan, it'll go effective January 1st. With Hurricane Helene and now with Hurricane Milton hitting the majority of our state and them declaring a state of emergency along a large part of the state, if not the whole state, it opens up what's called a special election period. So that's going to be an extended or a separate period to make a change for your plan. So you will also have your annual enrollment period, October 15th through December 7th. So if you are not dramatically affected by the storm, and can still make your election during that time frame, it'll go effective January 1st. If you're affected by the storm and you miss your annual enrollment period, Hurricane Helene and now Hurricane Milton, you're going to have an extended period. So AEP, the annual election period, is not extended. It ends hard deadline December 7th. But we will have extended or additional periods beyond December 7th to make a plan adjustment. There could be a lot of people losing their house. There could be a lot of people losing where they lived, due to hurricane and storms, and Medicare might not be their top priority at that moment. Where if they miss that December 7th cutoff to make a change for next year, they will have an additional window to make an adjustment. So don't freak out and try to cram everything in. Take care of your family and take care of yourself. There will be an extended period, but make sure you're reviewing your Medicare plan. Talking about Medicare plans really quick. So this is we're right in our annual enrollment period. If you've got a local insurance agent, reach out to them now, schedule an appointment, review your coverage. If you don't have an agent, feel free to reach out to me. You can, self-enroll or schedule an appointment with me right here to review your plan. You could even self-enroll and look at your plan options. Just scan that QR code and look at your plan options in your area. But there's a lot of changes this year. There are plans that are what's called sunsetting. So they're not going to be offered next year. And if they're sunsetting and you're not auto-ported to another plan within that carrier, if you don't make an election, you'll have no coverage come January 1st. So you need to make sure your plan is still going to be effective next year. If it's not, you need to make a plan choice. You've got two great options here if your plan's sunsetting. It's not going to be offered next year. You can pick any other Medicare Advantage plan that you would like, or drug plan, it doesn't matter. And you also have a guarantee issue right to go get a Medicare supplement policy. So there's a lot of people that talk about Advantage plans versus supplements, and they are very different. There's not definitely one is better than the other. It's all based on your unique needs and circumstances. They both got their, nuances, if that makes sense. They're positives and negatives. So supplements typically are higher premiums, but no network restriction typically. Where a Medicare Advantage plan are typically lower premiums, but they're network based with an HMO or PPO. So that's your biggest kind of difference between the two plans. So make sure you're on the right plan. If your plan is ending, you will have the guarantee issue to go get a Medicare supplement if you'd like. So here in Florida, if you're on a devoted PPO plan, I'm really focused here on the Northeast Florida area. So there could still be some plans in other parts of the state. But as far as the Northeast corner of Florida, if you're on a devoted PPO plan, that plan is sunsetting. You have a guarantee issue right to go get a Medicare supplement, or you need to change your Medicare Advantage plan, or you're only going to have Parts A and B come January 1st. Let's see, we've got Florida Blues older regional PPO plan. That plan is sunsetting as well. If you're on one of the older PPO plans, make sure to reach out to me or talk to a local agent to see if your plan is sunsetting or not. You will also have an option to pick another Medicare Advantage plan or get a Medicare supplement, guaranteed issue, no health questions. Or you're going to be, if you don't make an election before January 1st, you're going to have just A and B, and that is not smart, come that time frame. So because you are, it's dangerous to have only A and B. Let's see here. I'm going to keep changing my screen here to have this a little backdrop. I'm not sharing my screen anymore. Let's see what else we got here. Let's see, Florida Blues Medicare and Medicaid plan. If you're on their Medicare and Medicaid dual plan, that plan is also being terminated or sunset. So you will have the option to go choose another Medicare Advantage plan with, that's a dual plan. I highly recommend looking at those plans, other dual plans. Other than that, you're going to be without anything come January 1st if you don't make a selection. You also have guarantee issue rights to get a Medicare supplement, but if you qualify for Medicare and Medicaid, supplements typically not the best route to go for affordability reasons, but you do have that option. You do have guarantee issue rights at that time. I'm trying to think if there's some other ones more specific. Alignment Health. If you have an Alignment Health plan, I've already reached out to all of my clients to notify them that we're going to need to make a change earlier on, but we absolutely need to make a change now because that plan is definitely sunsetting. It's being terminated. It's not going to be available next year. Don't worry. There's lots of great plan options available, and we'll get you in one. But there's a lot of changes with Medicare this year, mostly due to the Inflation Reduction Act. Let's see here. Getting some good messages from my buddy Charles. Thanks, Charles. I appreciate you. So let's see. I'm trying to figure this live streaming out, and I can't seem to get it. I've got some hiccups in here. For some reason the comments aren't coming through in my live stream platform. So let me keep talking on a few other points. So the Inflation Reduction Act, there's some major changes with that, and most of the changes are driven around the Part D coverage, D for drugs. So with that, next year, the prescription donut hole is gone. So if you've been hitting the donut hole in past years, you don't have to worry about the donut hole this year, and you're likely going to save a lot of money on your prescription coverages this year. That being said, that it's going to help some, it's going to hurt others, because premiums on prescription drug plans have really gone up on most plans. If you're going to get a plan that has no deductible, it's going to be a much higher premium to have a standalone prescription plan with no deductible. Many Medicare Advantage plans are going to have prescription deductibles this year. So, and the way it works in general, there's 3 coverage stages now. I need to see if I can find let me see if I can find this chart that was sent to me and see if I can share it. Let's see. Talks a little bit about the risk taken on by the insurance companies and kind of how it's affected everybody. Let's see if I can find this thing. Where did it go? Oh, I'm close. Here we go. Let's see. Let's open this thing up. So this is a neat chart that was shared to me by a Florida Blue representative that talks about IRMA, the Income Reduction Act, and how it's affected prescription coverages. So this is a really neat graph. So this is 2024, how the prescription coverages kind of work. So 2024 and beyond, where if the plan had a deductible, the member, so the beneficiary, was responsible for 100% of the deductible. Once they met the deductible, the average during your initial premium coverage stage, the member would pay close to 25%, with 75% being paid by the plan. Then when they hit the coverage gap, or their prescription covered the donut hole, the member would continue to pay roughly 25%. The plan would then only need to be covering 5% and 70% being manufacturer discounts during the donut hole. So the member, you as the member, are all you really care about and see is the 25%. But the rest of the puzzle is extremely important, because they were getting manufacturer discounts of 70%, so the plan at that point was only needing to pay 5%. Then you hit catastrophic, the government covered 80% of the cost, and then the plan paid the other 20% of the cost for those prescription drugs. But the member's threshold or cap was at $8,000, and that included all of this number here. Well, it covered this 25% and then 100% while you're in the donut hole to meet $8,000. Now in 2025, the member cap is $2,000. So that's the most you'll pay to the pharmacy during next year for your prescription coverage, for your prescriptions, as long as they're on the plan's formulary and to cover prescription drug. So it needs to be on the formulary. If it's not on the formulary, it doesn't apply to that $2,000 max benefit. If it's, prescription vitamins, they don't count. Erectile dysfunction medications don't count towards that $2,000 medication. So, but there's a deductible phase. Then during the initial coverage phase, most members are going to be paying 25%. If your plan has a co-payment for tier 3 or tier 4, you're lucky. You're going to have a more managed cost. But still that full 25% is getting applied to that $2,000. But notice this, the plan, the insurance company, after your deductible during that initial coverage stage, the plan now is responsible for 65%, where they were responsible for 75%, but they're 65. There's only 10% manufacturer discounts. And then when you hit your $2,000 cap on your out-of-pocket, you're in catastrophic, where the government's going to pay 20%, the plan's still responsible for 60%, and we're going to get a 20% manufacturer discount. So what does this really mean this year? That is a large amount more at risk now to the insurance company, where it's a $2,000 member cap, so you're going to hit that much faster, but the plan, the insurance company, is having to pay a lot more. And that's good for you, but in one area, when you're picking your prescriptions, it's good for you. But the negative is that has added on a lot of responsibility to the insurance companies for every single member. So that is causing prices to go up in other areas, such as premiums or benefit reductions. So we're seeing much higher premiums on most Medicare prescription drug plans. There's actually a lot of prescription drug plans that are not going to be offered next year. So make sure if you're on a standalone prescription plan, make sure your plan's still going to be available. There's a lot of them that are companies altogether are no longer going to be offering standalone prescription drug plans. So make sure to review your coverage. I forget to mention that all the time. But that's a lot more risk to the insurance company. So that risk has to be managed, right? So to offset that risk, they have to, one, either raise premiums and or reduce benefits. So we are seeing benefit reductions on a lot of Medicare Advantage plans where maybe they're reducing some of the dental benefits, maybe they're raising some co-payments here, or adjusting some other areas, maybe getting rid of the Papa Pals thing where the in-home care support, they're having to reduce some benefits. And the plans are really smart. They look at utilization of benefits. So if your plan has a benefit but nobody's utilizing it, if they get rid of it and for a couple people or just a few people lose out on that benefit, but the mass majority never used it to begin with, it makes the most sense for the insurance company to do something like that. They still want to entice you to join their plan because they want to have members and they want you to be happy. They don't want to have some crazy things happen, and you lose benefits, but they have to also manage their costs so that they don't lose money. Insurance companies for the most part are for profit. Just like your doctor offices. So we've got a lot of network things going on. So doctor offices and hospitals are also for profit. So, they may say not profit, but they also need to make money. So like Baptist Hospital and their negotiations, they're supposed to be a non-profit company, but they need to make money to make ends meet and cover inflation and everything too. So not discounting that, they've got to renegotiate their contract. So things like that happen. And with your plan. So with Medicare, that's a lot of what's going on, and this was good to see the risk now added on to the insurance companies, because the insurance companies are now taking on a lot more risk for those prescription benefits. So know that's why there's major changes in these plans. So a lot of people are going to be paying 25%. If you're taking any brand name medications, your J.O., Ozempic, Januvia, some of the Symbicort, some of the inhalers, those might cost you more depending on your plan this year, but you will have a $2,000 maximum out of pocket. If your plan has co-payments for tiers 3 and 4, you very likely could be hitting that maximum out of pocket of $2,000 well before you actually pay $2,000, because you're getting credit for what the insurance company's paying during this window as well. So that's very important. So that's great news. So let me quit sharing this. Get back in here, see if I've got any more comments popping up. I'm trying to maintain everything. Let's see here. So there's a big thing, and then there's a big thing called smoothing, or M3P, with prescription drugs. This is going to be very confusing. I do want to point out, if you watch this, not everyone's going to benefit from the M3P program. And once you're enrolled, you need to utilize that program. So you can't I don't think you can just pick and choose what you use it for. So pay attention to that. Talk to your insurance agent. Have them explain how that will work to you. Reach out to me if you have questions. I'll do my best to answer them directly for you. I'd like the opportunity to be your agent. If you don't have an insurance agent, please reach out to me. I'd like that opportunity. I'm applying for the job to be your insurance agent. I promise to keep you informed. I hope to do more of these live streamings to keep people updated and good educational information on these plans and some of the benefits. So I hope you enjoy that. I am out of time. I have to get ready for my next appointment. But I hope everyone stays safe during Hurricane Milton. Please take care of yourself and your family and your pets. My hearts go out to everyone that's affected. I'm wishing in my prayers, praying for the best for everyone. I'm hoping for reasonable damage or minor damage, so to speak, because there's definitely going to be a lot of damage. This hurricane is absolutely going to punch Florida in the face, just like Helene did, just in a little further south. So I hope everyone makes it through okay. Please reach out to me if you need anything. I'll do my best to support and help you. I hope you're enjoying these live streams. If you got any feedback, if you do live streaming yourself, and maybe use the live stream software. Maybe you can help me adjust some of these things so it's working smoothly and I can see some of these comments come through, because I'm definitely missing some of them. But I'd love some feedback. How's everything? How everything looks? What I can improve on? I appreciate you all. Thank you so much. Stay safe, and we'll see you more than likely next week. Everyone have a great day. Thank you so much. Bye-bye.